Hey everyone, and welcome back to the Deep Dive.
Uh-huh.
Today we're going to be taking a deep dive into the world of autism spectrum disorder treatments,
Yeah,
specifically,
absolutely.
because a listener wrote in
Mm-hmm.
asking for a little more clarity
Yeah.
on the landscape of what's out there,
Right.
for ASD treatments.
Mm-hmm.
And they were really looking to go kind of beyond that surface level.
Absolutely.
So we've got some really interesting research
Yeah.
and insights to unpack for you,
It's going to be a good one.
including this really helpful breakdown of treatment types
Mm-hmm.
that you actually sent over.
Yeah.
And you even flagged
Yeah.
a specific excerpt that you thought was really interesting
Uh-huh.
from this source called Pasted Text.
Mm-hmm.
And so we're going to be kind of diving deep into that today.
Sounds good.
And buckle up, because we're going to be covering a range of approaches
Yeah.
from those really well-researched behavioral therapies
Mhm.
to some alternative therapies
Mm-hmm.
that you may or may not have heard of.
Right.
So the aim here is to really give you a solid understanding of the landscape of ASD treatments
That's the goal.
so that you can navigate all this info
Right.
with confidence.
That's great.
I noticed in the source material that we're working with today,
Yeah.
it kind of neatly organizes
Uh-huh.
different types of treatments into these
Oh.
specific categories.
Yeah.
But then it also mentions that in reality,
Mm-hmm.
many therapies blend approaches.
Yeah.
So is that a common thing?
Yeah, you're right. It's a really good observation.
Okay.
And it's actually a good sign.
Okay.
Because it reflects a movement towards more personalized and holistic
Okay.
approaches to care for individuals with ASD.
So it's not so much about these
Yeah.
strict categories.
Yeah.
It's really about finding what works best
Exactly.
for that individual.
Yeah, and understanding that everyone's unique
Okay.
and requires a tailored approach.
Gotcha. So
yeah.
our source points out that behavioral approaches seem to be the star of the show,
Mm-hmm.
at least according to,
Yeah.
their research.
Yeah, that's right. Based on research behavioral therapies,
Okay.
particularly applied behavior analysis, or ABA,
Okay.
have shown really, really promising results.
Okay.
They have the strongest evidence base for addressing those core ASD symptoms.
Yeah. So ABA is really considered
Yeah.
kind of the most effective approach.
Yeah, definitely.
So I'm curious,
Hmm.
what does ABA actually look like in practice?
So imagine working with a child who is having, and then use that information to guide them towards more positive ways of expressing themselves.
Okay, so it's like
Yeah.
you're kind of figuring out the root of the problem,
Yeah.
and then you're using that to
Exactly.
encourage better behavior.
You got it.
I understand that ABA can be delivered in
Yes.
different ways,
Mm-hmm.
right? The source material mentioned discrete trial training, or DTT,
Uh-huh.
and pivotal response training, or PRT.
Mm-hmm.
Could you explain the difference between those two?
You're exactly right. There are a few different styles of ABA.
Okay.
DTT is probably what comes to mind when people think of ABA.
Okay.
It's very structured and involves things like flashcards,
Okay.
repetitive drills, clear rewards for correct answers.
Uh-huh.
You break skills down into small steps
Okay.
and help the child master each step.
Okay.
PRT is different because it focuses on building up pivotal skills,
Okay.
the ones that have a ripple effect on other areas of development.
Okay.
And it's typically done in a more natural setting
So can you give an example? Yeah.
of what a pivotal skill.
Sure may. So let's say a child is struggling to start conversations.
Okay.
That ability to initiate interaction is a pivotal skill.
Okay.
Once they learn how to start a conversation,
Gotcha.
it unlocks a whole world of other communication opportunities for them.
Okay.
PRT focuses on teaching these pivotal skills in fun, engaging ways,
Okay.
using the child's interest to motivate them.
So rather than using
That's-
flashcards and drills
Uh-huh.
in a clinical setting,
Mm-hmm.
PRT might involve the therapist joining the child
Exactly.
in a play activity
That's a great way to put it.
and finding natural opportunities to
Yeah.
encourage those pivotal skills.
Right.
So we've got a handle on those behavioral approaches.
Yeah.
What about developmental approaches? It seems like those go hand in hand
Yeah, you're spot on.
with those behavioral therapies.
Think of it like building a house.
Okay.
You need a strong foundation.
Before you can build the rest of the structure.
Okay.
In this case, you need a solid foundation of developmental skills to support learning and growth.
So it's like those developmental therapies are providing the building blocks
Exactly.
for everything else.
Yeah.
Speech and language therapy comes to mind as a
Absolutely.
common
Yeah.
developmental approach.
Communication is fundamental. And for individuals with ASD,
Okay.
communication can take many forms beyond spoken words.
Okay.
Speech and language therapists
Uh-huh.
help individuals develop those crucial communication skills.
Okay.
Whether it's through verbalization, sign language, visual aids, or even assistive technology,
Gotcha.
it's about finding what works best for that individual.
And what about occupational therapy and physical therapy? Where do they fit in?
Occupational therapy focuses on building independence in everyday life.
Okay.
Things like getting dressed, eating, grooming, playing, and interacting with others.
Okay.
It might include things like sensory integration therapy,
Okay.
which helps individuals who are easily overwhelmed by certain sounds or textures.
Okay.
It's about giving them the tools to manage that sensory input and function better in their environment.
Right.
Physical therapy, on the other hand, works on gross motor skills, like walking and running,
Okay.
or fine motor skills, like writing or buttoning clothing.
So it's all about helping individuals develop the skills.
Mhm.
They need to be independent and comfortable
Exactly.
in their day-to-day lives.
Yeah.
One developmental approach I found really interesting
Yeah.
is the Early Start Denver model, or ESDM.
Right.
What makes that one unique?
ESDM is all about early intervention.
Okay.
It's specifically designed for very young children.
Okay.
What sets it apart is the emphasis on natural play-based learning.
Okay.
Therapists work closely with parents, incorporating those principles of ABA
Okay.
into fun, engaging activities
Right.
that target a child's language, social, and cognitive skills.
It sounds like they're weaving
Exactly.
learning into those everyday moments,
Yeah, got it.
making it feel natural and enjoyable for the child.
Exactly. And ESDM has shown promising results in improving outcomes for young children with ASD.
Speaking of different learning environments,
Yeah.
the source material you sent over also highlights educational approaches, specifically designed for classrooms.
Right.
One that caught my eye is the TCCH approach.
Yeah.
What's the philosophy behind that one?
TCCH is all about structuring the learning environment
Okay.
in a way that supports the strengths of individuals with ASD.
Okay.
The idea is that a clear and organized environment reduces anxiety and promotes learning.
So less chaos,
Yeah.
more structure.
Right.
Can you paint me a picture
Yeah.
of what a TCCH classroom
Right.
might look like?
Picture a classroom with clearly defined workspaces,
Okay.
visual schedules that outline the day's activities, and instructions that are presented not just verbally, but also with pictures or even physical demonstrations.
Oh, that's interesting.
Yeah.
So you're really giving them those visual cues,
Right.
that structured environment.
Uh-huh.
It takes the guesswork out of the day.
Yeah.
Helps them feel comfortable, safe, and in control.
Exactly.
Speaking of feeling comfortable,
Yeah.
I was also really interested in the social-relational approaches.
Mm-hmm.
I mean,
Yeah.
connecting with others is so important for everyone,
Absolutely.
but it can be extra challenging
Uh-huh.
for individuals with ASD.
Right. Social relational approaches recognize that building those relationships and navigating social situations is a big part of well-being for anyone.
Okay.
And there's a range of approaches out there
Yeah.
designed to help individuals develop those social skills.
I noticed the source listed out DIR floor time, RDI,
Yeah.
social stories,
Yeah.
and skills groups.
Right.
Can you give me a quick rundown of those?
Of course, DR Floor Time focuses on encouraging parents and therapists to engage with the child by following their lead.
Okay.
It's all about entering their world and building on their interests to create opportunities for connection.
Gus.
RDI focuses on developing deeper social and emotional connections
Okay.
by helping individuals understand the more nuanced aspects of relationships.
Okay.
It's about developing those skills for shared attention, emotional regulation, and flexible thinking.
So DR floor time might look like a therapist joining a child on the floor as they play with blocks.
Exactly.
While an RDI therapist might
Yeah.
engage in a back and forth game that requires turn taking and emotional regulation.
Exactly.
And social stories are those
Yes.
simple narratives that explain social situations and expectations.
They can be really helpful for navigating all those different social scenarios
Okay.
that can feel confusing sometimes.
And what about skills groups?
Skills groups are safe spaces for individuals with ASD to practice those social skills
Okay.
in a structured and supportive environment.
Okay.
It's a chance to interact with peers,
Gotcha.
learn from each other,
Okay.
and gain confidence in a setting where everyone understands the challenges.
I imagine that can be so valuable
Yeah.
especially for individuals who struggle
Right, yeah.
with those social interactions in less structured settings.
Absolutely.
I know we still have a lot to cover,
Yeah.
including medication.
Yeah.
But I want to make sure we don't run out of time for this section on all these different approaches.
Sounds good.
Let's move on to pharmacological treatments. That basically means medication, right?
Right. But I want to be very clear on this.
Okay.
There are no medications that directly treat the core symptoms of ASD.
Really?
That's a common misconception.
I had no idea.
A lot of people think that.
So if medications don't treat those core autism symptoms,
right,
then what are they used for?
They're often used to address what we call co-occurring issues.
Okay.
Things that aren't directly related to ASD itself.
Okay.
But that often make life more challenging for someone with ASD.
Okay.
Things like anxiety, hyperactivity, sleep problems,
Oh.
or even those really intense emotional outbursts.
Okay.
Medications can help manage those symptoms.
Gotcha.
But they don't actually target the underlying ASD.
So it's about managing those additional challenges that might come along with ASD. We've talked about behavioral developmental, educational and social approaches, as well as the role of medication. But what about mental and emotional well-being? Are there therapies specifically designed to address that for individuals with ASD?
That's a great question and one that's really important.
Okay.
Psychological approaches can be really valuable for individuals with ASD who are struggling with things like anxiety, depression, or difficulty regulating their emotions.
Okay.
One that comes to mind is cognitive behavioral therapy, or CBT.
Can you explain how CBT might be helpful for someone with ASD?
CBT helps people become aware of the connection between their thoughts, feelings, and actions.
Okay.
It helps them recognize those negative thought patterns that might be contributing to their distress and develop healthier coping mechanisms.
It sounds like it's about learning to reframe those negative thoughts and develop more positive ways of thinking and responding to challenging situations.
Yeah.
Can you give me a real-world example
Sure.
of how this might play out for someone with ASD?
Let's say you have a teenager with ASD who struggles with social anxiety.
Okay.
They might avoid social situations because they have negative thoughts like, everyone's judging me, or I'm going to say something stupid.
Okay.
These thoughts lead to feelings of anxiety and fear, which then leads to avoidance.
Okay.
CBT would help them challenge those negative thoughts.
Okay.
Replace them with more balanced and realistic ones.
Gotcha.
And gradually work towards facing those feared situations with more confidence.
Wow, that's so powerful.
Yeah.
It's like equipping them with those mental tools
Exactly.
to overcome those inner hurdles.
Right.
The source material you shared also mentions complementary and alternative treatments.
Right.
What does that category include?
Complementary and alternative treatments encompass a pretty wide range of therapies.
Okay.
Things like special diets, nutritional supplements,
Okay.
chiropractic care, animal-assisted therapy, music therapy, art therapy, mindfulness practices.
Wow.
And even hyperbaric oxygen therapy.
That is quite a range.
It is.
It sounds like somebody might be venturing outside those more conventional categories. Is there anything people should be aware of if they're considering one of these?
Yeah. Open communication with a doctor is paramount.
Okay.
It's crucial to talk to a doctor before trying any alternative treatments.
Okay.
To make sure there are no potential risks or interactions with other therapies or medications.
Okay.
Safety should always come first.
It makes sense to be informed and make those decisions in collaboration with a healthcare professional.
Exactly.
Okay. I think we've done a pretty good job covering these different approaches to ASD treatment. We've explored everything from those evidence-based behavioral therapies like ABA to those developmental and social approaches. And we even touched on the role of medication and mental health support.
Right.
It's clear there's no one-size-fits-all solution.
Absolutely.
So for you listening, what stood out to you the most?
Yeah.
Which treatment approaches are you most interested in learning more about?
Yeah. Good question.
As you continue to explore this landscape, think about what aspects resonate with you the most.
And as you process all this information, consider this.
Okay.
With all these options available, how can we best advocate for a more personalized and integrated approach to care that truly addresses the unique needs of each individual with ASD?
This is an important question to keep in mind.
It is.
As you continue your learning journey.
Absolutely.
It definitely is.
Yeah.
And we'll continue to delve deeper into these topics in future episodes.
Sounds good.
Stay tuned.
All right. It's amazing how much progress has been made in understanding and treating ASD, isn't it?
It really is.
We've gone from having very limited options to this wide array of approaches.
It's truly remarkable, but I imagine can also feel overwhelming.
Right.
Especially for families who are just starting to explore these options.
You're absolutely right.
Where do they even begin?
Yeah, it can feel like a lot to take in. But I think the key takeaway is that there's no magic bullet.
Okay.
No single treatment that will work for everyone.
Okay.
And the journey to finding the right approach can be complex, often involving a combination of therapies and strategies.
So it's about figuring out what works best for that specific individual, considering their needs, their strengths, their challenges, and their preferences.
Right.
And then creating a plan that's tailored just for them.
It's not a one-size-fits-all approach.
And it's not a static process either.
Right. As the individual grows and learns, their needs might change.
Okay.
And the treatment plan needs to be flexible enough to adapt as well.
So it's not like you find the right treatment and then you're done.
Yeah, it's about continual assessment, monitoring progress, being willing to make adjustments. And celebrating those milestones along the way.
So it's really a journey.
Yeah.
It's constantly evolving.
Exactly.
Sounds like any other aspect of health and well-being.
That's a great way to think about it.
You mentioned that treatment often involves a combination of different approaches. Can you give me a real-world example of how that might look?
Let's say a young child has just received an ASD diagnosis.
Okay.
And they're enrolled in an early intervention program.
Okay.
That program might use principles of ABA to work on communication skills, social interaction, and play skills.
Okay.
But at the same time, that child might also be receiving speech and language therapy to target specific speech delays and occupational therapy to address sensory processing challenges or fine motor skills.
So it's like this multi-pronged approach.
Exactly.
Addressing those different areas of development simultaneously.
That's a great way to put it.
And ideally, those therapists would be communicating with each other, sharing observations, and coordinating their efforts to make sure the plan is cohesive and consistent.
That's a great point.
As the child gets older, that treatment plan might evolve to include things like social skills groups, educational support that's tailored to their learning style, and even counseling to address any emotional or mental health concerns.
Exactly.
It all comes back to that idea of recognizing each individual's unique needs and tailoring the plan accordingly.
Absolutely.
We've talked about the importance of parents and caregivers as advocates. They play such a vital role in supporting their child's development. But with all these different approaches, it can feel daunting to navigate this complex world of treatment.
You're right.
So how can parents effectively advocate for their child's needs?
Such an important question.
Where do they even begin?
It's natural for parents to feel overwhelmed, especially when they're first starting out. But here's the thing. Parents know their child better than anyone else. Their insights are invaluable, and then they are their child's best advocate.
So how can they harness that knowledge and become more confident in advocating for their child?
I always encourage parents to educate themselves about ASD and the different treatment options. There are so many resources available from organizations like the Autism Society of America and Autism Speaks to research articles, books, and even blogs and podcasts from other families.
So knowledge is power.
It is.
It's about arming themselves with information, connecting with other families, and really understanding that landscape. What else can they do?
Building a strong support network is also so important. Connect with other parents who have children with ASD. Join support groups, seek guidance from professionals who specialize in autism. Having that community where you can share your experiences, ask questions, and get advice from people who truly understand.
Yeah, that can make a world of difference.
It truly can.
Knowing you're not alone.
And don't be afraid to ask questions. Lots of questions. Talk to your child's doctor, therapists, teachers. Anyone involved in their care, the more you understand their specific needs, the better equipped you'll be.
So be that squeaky wheel.
Exactly.
Don't be shy about asking for clarification and really push to get those answers.
Your child's voice.
You see their strengths and challenges firsthand.
Don't be afraid to speak up. And advocate for what they need to thrive.
It's about being their champion.
Yeah.
Their biggest supporter. Their fiercest protector.
Absolutely.
We've talked about the importance of individualized treatment.
Yeah.
But how can parents ensure that their child is receiving the most appropriate and effective care? What are some red flags they should watch out for?
Oh, those are excellent questions.
And what steps can they take if they're concerned that their child's current treatment plan isn't working?
It's so important for parents to be vigilant and proactive. Remember, every child with ASD is unique. What works for one might not work for another. It's about paying close attention to your child's progress.
So you're looking for those signs of improvement.
Are they making progress in those areas that are being targeted?
Those milestones, those moments that show they're moving forward.
Exactly. Are they developing new skills? Improving their communication? Managing their emotions more effectively? Are they showing signs of growth and development? Even if it's gradual, if you're seeing that progress, even if it's slow and steady, that's a good sign. But if you're not seeing any improvement, or if you're noticing any regression in their skills or behaviors.
So no progress. Or even backsliding.
That's definitely a red flag.
That's a sign that it might be time to reevaluate the approach.
Exactly.
What other red flags should parents be on the lookout for?
Pay attention to your child's overall well-being. Are they happy, engaged, motivated? Or do they seem withdrawn, anxious, or resistant to therapy? Treatment shouldn't feel like a punishment or a chore. It should be a positive, empowering experience.
It's about finding that balance between challenging them to grow and ensuring that they feel supported and encouraged along the way.
And trust your gut instinct. You know your child best. If something doesn't feel right, if you have doubts or concerns about the approach, don't hesitate to voice them.
So trust that parental intuition. It's often more accurate than we give it credit for.
Absolutely.
If a parent has those concerns, those red flags, what steps can they take to address them?
The first step is to talk to your child's therapist or doctor. Share your observations. Ask those questions and express your concerns openly and honestly. Remember, you're on the same team. Working towards the same goal. Open communication is key.
So it's about working collaboratively.
It is.
To find solutions.
Exactly. And don't be afraid to seek a second opinion. If you're not getting the answers you need. Or if you're still unsure about the best course of action. It's okay to consult with another professional to get that additional perspective. And make sure you're exploring all your options.
So it's really about peace of mind.
It is.
It's about knowing you've done everything you can to support your child.
Absolutely.
We've talked about the importance of individualized treatment. And you mentioned all those different treatment options. From evidence-based therapies to those more alternative approaches. How do you sift through
that's
all that information?
That's a big challenge for many families.
And make those choices.
And unfortunately, there is.
Especially when there's a lot of misinformation circulating about autism treatment. It can be so hard to separate fact from fiction.
It's like wading through a sea of information overload.
It is.
How do you cut through all that noise and find those credible, evidence-based answers?
A good rule of thumb is to be cautious of any treatment that promises a cure for autism. There is no cure.
It's a lifelong neurodevelopmental condition. There are so many great treatments that can help individuals thrive, but nothing will make autism disappear. So if someone is promising a cure, that's a red flag.
So be wary of those cure-all claims, those promises that sound too good to be true.
Exactly.
What else should parents watch out for?
Be skeptical of treatments
Okay.
that rely solely on testimonials or anecdotal evidence rather than solid research.
Okay.
Just because a treatment worked for one person doesn't mean it will work for everyone. It's really important to look for those studies. That scientific backing that evidence that a particular approach has been proven effective.
It's about being an informed consumer.
It is.
Asking those tough questions. Not being intimidated by those complex terms. Doing that research. And seeking those evidence-based answers.
Got it.
And
remember, you don't have to navigate this alone. There are reputable organizations and professionals out there who can provide guidance and support. Don't hesitate to reach out.
So reach out to your doctor. Connect with those reputable autism organizations and tap into those resources that are available.
Absolutely.
Speaking of those evidence-based approaches, we've already talked about ABA, but what other therapies fall into that category?
Great question.
In addition to ABA, another therapy that has shown positive results is pivotal response treatment or PRT.
PRT, we touched on that earlier.
PRT.
It focuses on those pivotal skills, those foundational skills that have a ripple effect on so many other areas.
Exactly. It's a more naturalistic.
It's a naturalistic, play-based approach.
Play-based approach.
It's all about creating opportunities for learning in ways that feel meaningful and engaging for the child. PRT has been shown to be effective in improving communication skills, social interaction, and play skills. That's so encouraging.
Are there other evidence-based approaches that have shown promising results?
Another one that comes to mind is the Early Start Denver model, or ESDM.
ESDM.
Remember that's the one we talked about earlier?
Yes, ESDM.
That's specifically designed for very young children.
I remember you mentioned that it involves a lot of play-based learning.
It's a comprehensive approach that combines those principles of ABA with developmental psychology. It's about promoting learning through those natural, playful interactions. Studies have shown that ESDM can be very effective in improving cognitive skills. Language development, and social interaction in young children with ASD.
Early intervention is so powerful.
It is.
It's amazing to see these evidence-based therapies making such a difference in the lives of young children. What about older children and adults? Are there evidence-based therapies that are helpful for them?
Absolutely. One therapy that's been shown to be very effective for older children and adults with ASD is social skills training. Or SST.
So I'm guessing that involves helping them
develop those essential social skills.
You
got it. It's about teaching those specific skills. Like how to start a conversation. Read social cues. Understand those unspoken rules of social interaction. And manage their emotions in different social situations. It's like equipping them with those tools to navigate that complex world of social interaction.
That makes so much sense.
I
can see how valuable that would be. Especially as individuals with ASD get older and those social expectations become more complex.
Exactly. And studies have shown that SST can help improve social skills, reduce anxiety, and increase social participation in individuals with ASD. It's about helping them feel more comfortable and confident in those social situations.
We've covered a lot of ground here with these evidence-based therapies.
We have.
But I'm curious, how do these therapies actually work? What are the underlying mechanisms?
That's a great question.
That make them effective?
And the answer is that it likely involves a combination of different mechanisms, depending on the therapy. But there are a few key principles that many of them share.
Can you break those down for me?
One of the core principles is the idea of breaking down complex skills into smaller, more manageable steps. It's called task analysis. And it's a cornerstone of ABA.
So it's about taking those bigger goals and making them less daunting, more achievable. By breaking them down into those bite-sized pieces.
Exactly. It's like building a staircase. One step at a time. By breaking those skills down into those smaller steps. Therapists can provide more targeted instruction and reinforcement. Which helps the individual learn more quickly,
Okay.
and experience more success.
That makes so much sense.
Yeah.
What other principles are important?
Another key principle is reinforcement.
Okay.
Reinforcement is anything that increases the likelihood of a behavior happening again.
Okay.
It might be something tangible, like a sticker or a small toy, or something intangible, like praise or a high five.
Yeah.
The idea is that by rewarding those desired behaviors, those steps in the right direction, you're encouraging those behaviors to happen more often.
It's like that positive feedback loop.
It is.
You're reinforcing those positive actions and shaping those positive outcomes.
Exactly. And that reinforcement needs to be tailored to the individual's interests and motivations.
Okay.
What motivates one child might not motivate another.
Right.
It's about finding those reinforcers
that
are truly meaningful and effective for that individual.
So it's about personalizing those rewards.
Yeah.
Finding what truly clicks for each person.
Right.
What other principles come into play.
Another important one is prompting and fading.
Okay.
Prompting involves providing assistance to help the individual learn and perform the desired behavior.
Okay.
It might be a verbal cue,
a
gesture, or even physical guidance.
Just like those training wheels. It's extra support to help them get going.
Exactly. And as the individual learns the skill, those prompts are gradually faded out. So eventually they can perform that behavior independently. It's about fostering that sense of mastery, that sense of accomplishment.
It's about empowering them. To do it on their own.
Right. And prompting and fading aren't just about teaching new skills. They're about promoting what we call generalization. Generalization is the ability to apply those skills in different settings with different people in those real life situations.
So it's not just about being able to perform the skill in a therapy session.
Exactly.
But about being able to use it in their everyday lives.
You got it. And generalization is one of the key goals of many of these evidence-based therapies.
Gotcha.
It's about making sure those skills are truly functional and impactful.
I know a lot of listeners might be wondering how to know if a therapist is qualified to provide these therapies.
That's a great question.
What should parents look for when choosing a therapist?
First and foremost, you want to make sure the therapist has the appropriate education, training, and licensing. For example, if you're looking for an ABA therapist, you want to make sure they're a board-certified behavior analyst or BCBA.
So BCBA, that's the gold standard.
That's the one.
When it comes to ABA.
You want to look for.
What about therapists who specialize in other areas?
For other therapies, like speech therapy, occupational therapy, or counseling, make sure the therapist is licensed to practice in your state and that their area of expertise aligns with your child's needs.
So those are the non-negotiables. Licensed, qualified, and experienced in those specific therapies.
Exactly.
What else should parents consider?
You want to look for a therapist who has experience working with individuals with ASD. And ideally, experience working with children in your child's age range. And don't be afraid to ask them about their approach. What methods do they use? How do they involve parents in the process? It's about finding a therapist who feels like a good fit for your family. Someone who aligns with your values and your vision for your child's care.
So it's about feeling that connection, that trust, that shared understanding of what you're working towards. You mentioned earlier that medication doesn't treat those core symptoms of ASD.
It doesn't.
But it can be helpful.
But it can be helpful.
In managing some of those co-occurring conditions.
Things like anxiety.
Like anxiety.
Hyperactivity or sleep difficulties.
Hyperactivity, sleep difficulties.
But it's important to remember that medication isn't a cure-all.
Right.
And should always be used with caution and careful consideration.
So it's not a decision to be taken lightly.
Exactly. It's a decision that needs to be made in close consultation with a qualified doctor. Weighing the potential benefits against any potential risks.
So it's about finding that balance.
Yeah.
Making those choices collaboratively with your child's healthcare team.
Right.
And closely monitoring their progress to make sure the medication is having the desired effect.
Exactly.
We've talked about those therapies that focus on specific skills.
Yeah.
But I want to shift gears and talk about a topic that's often overlooked. The emotional well-being of individuals with ASD.
Right.
They experience the same range of emotions as anyone else.
They do.
But they might express those emotions differently.
Right.
Or have a harder time understanding and regulating them.
That's such an important point.
So it's about being aware of those subtle cues.
Right.
Recognizing those differences in how they express their emotions and creating that space for them to feel safe and supported.
Exactly. And remember, individuals with ASD are also at a higher risk of experiencing anxiety, depression, or other mental health challenges.
No, that makes sense.
Yeah.
Given the challenges they face navigating a world that isn't always designed to understand or accommodate their needs.
So if you notice any signs of emotional distress, don't hesitate to seek professional help. There are many great therapists who specialize in working with individuals with ASD. And they can provide those tools and strategies to help them regulate their emotions and build resilience.
It's about helping them develop those coping skills, those strategies for managing those big emotions, and those tools to navigate those inner landscapes that we all experience.
It's about supporting their emotional well-being just as much as their physical health and developmental progress.
Now, I want to touch on a topic that can be challenging for both individuals with ASD and their families.
Right.
Challenging behaviors.
Challenging behaviors are a common concern.
Those behaviors that might be disruptive, harmful, or difficult to manage.
It's been an amazing conversation, hasn't it?
It really has. We've covered so much ground from those fundamental principles of ASD to those cutting-edge therapies.
Right.
It's incredible to see how much progress has been made in understanding and supporting individuals with ASD.
I completely agree. And I think it's so important to remember that behind those diagnoses, behind those labels, are real people with their own unique strengths, challenges, and dreams.
That's such an important point.
It is.
It's about seeing the person, not just the diagnosis.
Exactly. And it's about celebrating those differences. Recognizing that neurodiversity is a valuable part of the human tapestry.
I love that.
Yeah.
It's about creating a world
where everyone feels valued, included, and empowered to be their authentic selves.
That's the dream. And I think we're moving in the right direction.
Yeah.
There's a growing awareness and acceptance of neurodiversity. And there's so much incredible work being done to support individuals with ASD and their families.
I'm so inspired by all those advocates.
Me too.
Those researchers, those therapists, those educators, those families. Everyone who's working tirelessly to create
a more inclusive and supportive world.
A more inclusive and supportive world.
It's truly a collective effort.
It is.
And we all have a role to play.
So what can our listeners do to make a difference?
First and foremost, educate yourself. Learn about ASD. Challenge those stereotypes and misconceptions. Be an ally. Speak up against discrimination and injustice.
So be an advocate. Be a voice for change. Exactly. And remember, the most powerful thing you can do is simply be kind, compassionate, and understanding. Treat individuals with ASD with the same respect and dignity you would anyone else.
It's about those everyday acts of kindness.
It is.
Those small gestures that can make a big difference.
Absolutely. And if you're looking for ways to get involved, there are so many amazing organizations out there doing incredible work. You can volunteer your time, donate to a cause, or simply spread awareness.
So get involved. Make a difference. Be part of the solution.
That's the spirit. And remember, change starts with each and every one of us.
So beautifully said. And now, as we bring this deep dive to a close, I want to leave our listeners with a final thought.
Sounds good.
To those listening who are on this journey with ASD, either personally or through a loved one.
You are not alone.
There's a whole community out there.
There is.
Ready to support you, to guide you, to celebrate your triumphs, and to offer comfort during those challenging times.
Remember, there is hope.
There is strength.
And there is a future filled with possibilities.
So keep believing. Keep fighting. And keep shining your light.
Thank you for joining us on this journey of discovery.
We'll see you next time on The Deep Dive.